we're going to get started on time. I'm Dawn Magretta, the Executive Director of the Schoolcraft College Foundation, and we're happy to bring this virtual program to you thanks to Vision 2025. And I am just going to say a few housekeeping items. Everybody will be on mute. There will be opportunities for questions. So as you're going through the program, you can enter your questions in the chat box. If for some reason you freeze up or have a problem with Zoom, please try to refresh or log back, log out and log back in. So at this point, I am happy to turn this over to Dr. Glenn Cerny, President of Schoolcraft College. Dr. Cerny.
Thank you, Dawn. I want to thank everybody for tuning in. At some point, this is going to be hopefully one of the last Zooms that we do. We're going to do these in person in Deponio or in the Curl Auditorium or in our great, different places that we have here on campus. But today's topic is very important, and it's about meeting the needs of the community and the students. And how do you do that in terms of, not only just medical services, but from an educational standpoint? And we have at Schoolcraft done some very unique collaborations with our partners. And actually one of them is Trinity Health, which is part of St. Joe's and IHA. They have a $50 million medical center right here on our campus. That's one of the ways that our speakers are going to talk about in terms of how do you collaborate with the workforce to make sure we have staff that fills that building, and also for the community that can take the benefit of those services. So those are the unique things that the topics are going to be discussed with our great panelists here today. But I want to thank you guys for supporting Schoolcraft College. Our mission here is steadfast, student engagement, student success, and making sure our community is thriving. And so with that, I'm going to turn it over to my partner in crime and my collaborator, who we are collaborating on everything, the president of St. Mary's and VP of all kinds of Trinity things, David Spivey. So David, it's your ball game.
Just a minute, David, you are still muted.
Does that work? All righty. Well, thank you, Glenn. And, it's a real pleasure to be here this morning to talk about our partnership with Schoolcraft College. It's been a long partnership, and in many respects, I think the development of our respective organizations over the course of the past 10 to 20 years has really been in parallel in terms of the sophistication and the services that we have brought to the community of Western Wayne County. It's been a real pleasure to work with Glenn over these years, and I look forward to a really vibrant future. To all the alumni, faculty, students, and members of our community, thank you for taking your time out of your busy day to learn more about our partnerships and the St. Joe's IHA Livonia Medical Center. I've been with Trinity for so many years. There's probably people who weren't alive who are on this call today, who are on the call, and I won't tell you how many years, but a number of years, and it's been a real privilege to be part of the Trinity Health System and the greater Western Wayne County and Livonia community. One of my proudest accomplishments has been the collaboration between our health system and Schoolcraft College. And it really goes back a number of years, when we became a sponsor of the St. Joe Sports Dome on campus. Then in 2017, we opened up an urgent care center in the Jeffers building. More recently, of course, the St. Joe's Mercy Elite Center, and now our 124,000 square foot Livonia Medical Center, which actually costs $90 million, not 50. So nearly twice that investment, and one that we think is going to really pay dividends for those in Western Wayne County for many years to come. This is a real advancement in our health systems provision of ambulatory care services in the community, which is where healthcare is going these days, working in partnership with clinicians and the IHA medical group. And it's going to have a significant economic impact on the community as well. When all the programs are implemented, we will employ over 300 people at the site and create more than 150 new jobs, good paying jobs, again, for the residents of Western Wayne County. And being on the Schoolcraft College has its benefits in terms of being able to integrate into the educational programming that exists at the college and provide experiential learning to be on top of the classroom learning that exists within the school, and avenues for full participation in the healthcare workspace as we move forward. We could have done this without our partner medical group, IHA, which is really a wonderful partnership. IHA is a medical group that's sponsored by Trinity Health, part of the St. Joe's and St. Mary family here in southeastern Michigan, and is a growing, large multi-specialty group. Its origins were in primary care, but it's grown to be a large multi-specialty group over the course of the past 10 years or so. And it really is a great resource for health in our community. And it's going to position, the residents, again, of the Livonia area well as we move forward into the future. We've been working alongside them for a number of years. And of course, the Livonia Medical Center is their most recent expression of that working relationship, provide efficient, high quality ambulatory care to the residents of Western Wayne County. Dr. Ajluni is going to share with you all the various services that are provided there. He is our medical director over urgent care services within IHA and oversees, of course, a lot of activity at the Schoolcraft facility. And again, on behalf of Trinity Health, Michigan, St. Joe's, and St. Mary's, we've got lots of monikers. We're very proud of our working relationship with Schoolcraft College and to be on the campus of your school. So this time, let me turn it over to Matt Ajluni, Division Head of IHA's Urgent Care, to share with you some of the great services that are provided.
All right, thank you, Dave. Appreciate that introduction, and good morning to everybody. My name, as Dave said, is Matt Ajluni, and I'm the Division Head at IHA for Urgent Care, Virtual Medicine, and Travel Medicine. I've been with IHA Trinity for about 8 or 9 years. I'm one of the people that Dave mentioned wasn't alive when he started working for Trinity. Just kidding. I'm actually, I'm sure I was alive then, Dave. But I've been excited. I'm very excited to present this morning and talk about this great facility. And I've been on the Schoolcraft campus helping lead the urgent care that's been in the Jeffress Center for the last few years. And, my relationship, interactions, all my communication with the Schoolcraft leadership and everyone there has just been nothing but positive. It's been really a synergistic relationship from my perspective, and I think this building will only amplify that and underscore that. So I'm really excited about that. We're really excited to bring a group of great high quality healthcare providers and staff and a vast set of services, really to offer the continuum of care from birth to middle ages to elderly care, all under one roof in a convenient location for our communities. This medical center is positioned right in the middle of our Southeast Michigan region, and it's going to bring our IHA physicians closer to this community, again, to provide seamless care across physicians' offices, outpatient facilities, and our hospitals. We've been working to bring healthcare out into the community where people live, work, and play, and this medical campus there is another great example of that. And we're confident that we're going to be able to meet the needs of the Livonia community through the vast set of services that are being offered at that facility. Opening this medical center was conceived of as a healthcare campus of the future, and really a partnership between IHA, St. Joe's, and Schoolcraft, and a true highlight for myself, and I know Dave and all of our colleagues across IHA and Trinity. So many of you know we broke ground in 2019 with plans to open this past spring, all at a time when we were blissfully unaware of what was coming in 2020. And in spite of that tumultuous period of time, this center amazingly opened as scheduled in April, and was really a testament to the fortitude and hard work and perseverance of all the teams that came together to bring this facility to fruition. So as Dave mentioned, though, when you look around the Schoolcraft campus, you'll see why this project is so special. It's a location right in the heart of St. Joe's service area, and it's just the proximity to the community, the accessibility and the convenience are really unmatched. Just a couple comments about the building itself. It's a 124,000 square foot facility that we're calling the Livonia Medical Center. Wow you with some of the stats, where the $90 million was spent, 85,000 bricks. Those bricks are expensive. Probably would have cost more, actually, wouldn't it have, if we had built after the pandemic, but 1,700 cubic yards of flat work concrete, 474 doors, 142 miles of electrical wire, and 2,600 lights make up this building. And what's inside of it? 13 practices, 119 exam rooms, 4 operating rooms, soon to be 5, and 18 pre and post-op bays for our surgical patients, with plans and opportunities for even overnight care for patients for very short stays, post-operative stays.
Dr. Ajluni, we are actually showing the virtual video.
I see it, yeah.
If you want to talk to that too, I'm sorry to interrupt. I just don't want to miss this opportunity.
No, absolutely. This is beautiful. Thanks. So you can see some of the bricks I was talking about and cubic yards of or miles of electrical wire, but this is an overview of the site with, you can see a lot of parking on the north side of the building there, which is your left, is going to be the surgical suites, as I understand, and imaging centers, and to the right side houses all of the primary care practices and surgical practices that are in the building. I was going to also just talk about the practices that are in the building, not to go through all of them, but we will have orthopedics, podiatry, physical therapies in the building, plastics and reconstructive surgery, women's specialty imaging. I'm not prepared to give a full tour as this video goes in, but I know that Joe's Java is there as well, which is the famous coffee shop and cafe that will be there. There's a pharmacy, as you can see. I work in the urgent care, and so that is just off to the right as we go there, as well as our pediatrics office is housed right next to our urgent care. And then upstairs is the family practice offices and the other specialty offices. I would also like to mention that there's going to be St. Joe's lab services there. So when you think about the amount of services being offered there, it's really, in a lot of ways, one-stop shopping. It's not everything there is. We will not have an emergency room there, but really the vast majority of healthcare needs can be handled there, and such a convenient way, and also just the coordination of care is really exciting and allows us to deliver a better quality of care. So if I'm seeing a patient that's pediatrician is down the hall, I can go talk to that pediatrician and we can discuss the case in real time right there. If someone that needs orthopedist, I can just send them upstairs and talk with that orthopedic doctor. Our family medicine and obstetrical practices have close coordination. So it's really a great value to patients and our ability to deliver high quality care. Not to mention the surgical, the ability to get surgery right there at that facility. And then I'll be remiss if I don't talk about the exciting partnership that when the new Health Science Center is in place, is that coordination between the ability for students to be in the classroom and then walk next door and be in a real world practicum, and then hopefully find a job in the future or a career in that same building. That path is a win-win for students, for the healthcare facility and our system, and for the community. And what a great partnership that is. So happy to answer questions as we get to that part, but now I'd like to turn it over to the Schoolcraft College's Associate Deans for the new Health Science Center.
Sure, and I guess I'll get started. I'm Dr. Dave Kesler, DC. I'm the Associate Dean of Health Professions for Schoolcraft College. What that means is I oversee the emergency medical technology programs, the health information technology programs, the medical assisting programs, the pharmacy tech programs, and then also our new medical imaging programs, which include radiologic technology and diagnostic medical sonography. And we also have some other programs in development. And I'm just here to answer any questions that you may have about how these programs can integrate with the Livonia Medical Center, St. Joe's and IHA, as well as students in the community in general. Debbie?
Hi, and I'm Debbie Vendittelli. I'm the Associate Dean for Nursing at Schoolcraft. I've also been a faculty here. I'm over the registered nursing program, and then we have a practical nurse option within our 2-year program. And then we also educate LPN to RN students who already have their license, and then they want to go on and get their associate degree in nursing. I'm also over the nursing assistant program. And as part of that, we're going to be doing another new course that will be an add-on home health course option. They'll have to have the nursing assistant course and get the certificate first, but then they can do the home health option. And we're already in talks with a partnership with Trinity Home Health to work and see about the students going ahead and doing their clinical, again, with real time, actual nurses and, their home health aides. So we think that's really exciting. And we're hoping to have various different students come to the clinic and be able, like you said, to be able to do extra clinical experiences there with our nursing students. So we're excited to work on all those different collaborations. And again, we're ready to answer any other questions you might have about any of our programs or any other things. Thank you.
So while everybody, you can pose questions in the chat box. I just wanted to ask Dave and Debbie a little bit about the expansion of the Health Sciences Center. We are in the process of, you'll see construction going, expanding that center. What new programs or expanded programs will be in that center, and how does that fit in with our discussion today?
Go ahead, Dave. You can go first.
Okay. So yeah, a lot of the programs are relocating to the expanded Health Sciences building. Many of those programs are currently housed at the Radcliffe Center. So programs that will be moving over from Radcliffe to the Health Sciences Center include the Emergency Medical Technology, the HIT program with Health Information Technology, Medical Assisting, and Pharmacy Technician. And then some of the newer programs, they'll begin over at the new Health Sciences building, and that would be our diagnostic medical sonography and also the rad tech. And also Debbie can talk about the expansion that'll be going on in that building for nursing.
And for nursing, we're really excited. We currently have 2 labs. And then we also have a simulation lab where the students can go there and practice in a safe environment. We have really cool computerized mannequins to be able to do that. But in the new space, we're going to have more lab space. And then the labs are definitely going to be more state of the art. They're set up to be like hospital room environment. And we actually, for each of the labs, will have a bariatric lift. And I think we're probably the only community college I know of that's going to have that. And a lot of the patients now are heavier. And so we'll be able to have the students practice with those lifts while they're here, because a lot of different units have those. So we think that'll be really cool. Another addition we got on there is we're actually going to have a medication room. So the students, you know, can be at the bedside, and then they can also go to the med room. Pharmacy tech has a program there with a pharmacy area. So if they have to go to pharmacy, you know, like in real life, so it's going to be really cool. And then we also have expanded storage area. So that's great because we're expanding the program. We, in the past, only admitted students in the fall, and now we're admitting first-year students also in the winter. And last year we had a group, but this year we're doubling that size. So our program is really popular, and it's going to be great to have this new environment so we can continue to grow and the faculty can continue to do their jobs and do them well.
Thank you. So this next, I have a comment and a question. First of all, and they're both for Dr. Ajluni and Mr. Spivey. It's a beautiful building. I've been there a couple of times already. Love IHA doctors. And Linda said that. And then the question is, are there large conference rooms to hold health-related classes for the community, such as diabetes prevention? So that's for, yeah, Dr. Angel.
Dave,
do you want to take that about the conference room?
I understand there are some classrooms available, and we have a pretty prominent diabetes prevention programming. So yes, we would love to be able to host additional classes there because, I've become a big adherent to diabetes prevention programming. I mean, let's not wait till people have diabetes. So let's start working with them sooner so that we can prevent it from occurring. So yes. If you can provide me your contact information, I'll put you in touch with our people, Mary Neester and Michaeline Ratska, to help facilitate that.
Okay. Are textbooks and instructor education being updated to keep pace with scientific research and development? That, I guess, what I would pose to Dave Kesler and Debbie Vendittelli.
Yeah, that's an ongoing process in all of academics here at Schoolcraft, that we're constantly updating our textbooks and materials, and also adapting to new methods of learning. So the pandemic was a big eye opener for that, with remote learning and a lot of different modes of delivering information. So yes, that's a continually developing process.
Deb, do you have anything to add to that?
It's basically the same. The hard part always is anytime you get a textbook, it's always like 3 to 5 years behind. So you always have to augment the textbooks and the materials you have, thinking about that process. And then you use evidence-based practice and integrate that, along with different research things too. But I think the faculty here really do try and keep up with what's going on.
Thank you, Debbie. Also, I have another question. How long has Schoolcraft offered our nursing programs and degrees?
So the practical nursing program has been around since the 60s. That was the first program here. And then the RN program was developed and instituted in the mid 70s. So they've been around for a really long time. And then we added on the option for the LPNs to come back, and they do the second year courses, and then they get their degree. So, we started out with that group with like 8 students way back. And then we increased it to 16, then 32. Now we have between 60 to 80 or more per year. It's a very popular program. And it's very exciting to be able to help people, go through the process and continue their education to various different levels.
Thanks, Debbie. I have another question, and it sort of plays into a couple of questions that I have that have been posted. The first question is, please explain the differences between an ambulatory care center, a hospital, and an urgent care center. And then, does the center that we have on campus here offer inpatient services too, or just ambulatory services? So I guess that's you, Dr. Ajluni.
Yeah, thank you. So good question. The Livonia Medical Center would qualify as an ambulatory care center, and it's really the bringing together of all these services that are handled in an ambulatory manner. So things that don't necessarily need to be housed at the hospital. The hospital is there for our acute care needs, for high-level imaging, for overnight hospitalizations. There's an emergency room there, but within the ambulatory care center is the slate of services that I described, including primary care, specialty care, surgical care, and then also within there are these other sets of services such as pharmacy, physical therapy, and imaging services. And the beauty of that is really stuff I highlighted in my talk, but it's the convenience and ease of accessibility, and that it's all in one easily accessible location. So you're not driving to a physical therapy, then to the pharmacy, then to your primary care, then to the urgent care. You can go to one place and get all those services. And oftentimes the costs, our ability to deliver those services can cost us less, and that cost we pass on to our patients and community is less than what it takes to keep a hospital running, which Dave knows all about. So that kind of encapsulates an ambulatory care center. We do have some limited plans that have limited overnight capacity there, and those would mainly be for post-surgical patients that might need more hours of observation after having a procedure, but it's not meant to be a hospital where we're caring for patients for several nights in a row. So that higher level ICU care, obstetrical care, all that still remains in the hospital domain, but many of those other services we can manage in an ambulatory center. Urgent care facility, you asked that question, and that's just one more service that's within the ambulatory care center. And so we have an urgent care facility that services many of those acute care needs. But we are sending things to the hospital that are outside of our ability. So heart attacks and strokes and things that might need to go straight to the operating room, those are things that are going to the emergency room and then the hospital. I'm sure Dave could embellish on some of the stuff I described, but that's the answer to that.
Yeah, well, one thing to note, and it was referenced in Matt's comments, is there's a shift in the location of where care is being provided that has been going on for a number of years, and will continue to go on, where certain services like hip and knee replacement surgeries, which used to be performed in a hospital, are increasingly performed on an outpatient basis, and safely and in a high quality and cost effective way. And what this facility allows us to do is have a continuum of care, so that the best place to receive services will be what the patient receives. So it's exciting from that standpoint as well.
Okay. One of the things that you referenced, Dave, was the other things going on at Schoolcraft. And I don't know if you could talk a little bit about the Mercy Elite Center and what's going on here. I mean, we can from Schoolcraft side, but this has been a very unique partnership that I think people don't even realize what's available to the community.
Yeah, Mercy Elite is a sports performance, athletic training, and specialized physical therapy service that provides services to teams and athletes from 8 to 80 is how we describe it. So really all ages, beginning with kids and and then obviously up to senior citizens. And so there we have athletic training services, sports conditioning services, and physical therapy services for athletes, and again for across the age spectrum. And we provide services to teams, some of the Schoolcraft's teams, a lot of the clubs in the community, soccer clubs, volleyball clubs, and then we have retail offerings as well, where you can link up with a trainer and have a personalized training experience there.
Thank you, Dave. Actually, my daughter was with the soccer team here, and she said that the facility was even better than the D2 campuses she was familiar with. So it's very unique that Schoolcraft has such a facility on campus, and it wouldn't have been made possible without this partnership. Dr. Cerny, would you like to talk a little bit more about that? About the Mercy Elite Sports Center?
Sure.
Or add any comments?
Yeah, I think it's a combination of the community. I mean, that's what it amounts to. I mean, you're going to see adults playing volleyball during the morning. You're going to see them playing pickleball in the morning. You'll see kids coming in at 4 o'clock, traipsing in, and there's like 150 of them right now, and I'm watching them on the screen over here playing volleyball in their camps. It goes to the heart of a thriving community. And, the partnership with St. Joe's and IHA, Mercy Elite is doing the physical training there for our athletes. For all Schoolcraft athletes get training through Mercy Elite. But they also train the community as well. And we've got a movement science program that I'm going to push over to Dave and talk about that actually is getting real data as a part of the testing. And we're working with Dan Walaco from Mercy Elite on that. I'm going to jump that over to you, Dave. I don't want to steal your thunder on that one.
Yeah. Well, the movement science program, at Schoolcraft works in partnership with Mercy Elite, and it can, evaluate the athlete from a physiological standpoint and help and feed information into the training plan. So it can look at their respiratory conditioning, their heart rate, those types of things, their muscle mass configuration, all the things that are necessary from a science perspective to optimize your performance as an athlete. So we're really excited about that lab that's there in the facility, and looking forward to extending it even further beyond what the services are today. The other thing I think is from just if you step beyond the facility, you've got the dome, you've got the practice field, so you really have a 365 day capability, to provide athletic services again to the community. And it's great to get people on campus, right? Because some of those folks are going to take classes at Schoolcraft College and become graduates of the school.
So Dave Kesler, can you talk from an academic standpoint in terms of what that has allowed us to do with our programs there?
Yeah, and just building on what Glenn and Dave were saying about the movement science lab, as they mentioned, it does offer muscle testing. They have the Biodex system isokinetic dynamometer for metabolic measurement. They use a Parvo metabolic heart monitor. For body composition tracking, they use what's called the BOD pod, and that is the real name of it. And that it actually uses air displacement to measure a person's body fat, which is kind of neat because a person can do that and not get wet. Normally, you'd have to go into a pool or use calipers, but in the movement science lab, you just sit in a egg-shaped device, and it actually measures your body fat. So, and not a lot of places have that specialized equipment, so it's nice to see it all in one place, so that athletes and students in the community can utilize that, and also people can get trained on how to use that equipment as well.
Thanks. And then one other thing that one of the things we have is a fitness center, and that is all connected with the Mercy Elite facilities. So for those of you in the community, we have a track, we have, it's open to the community. And athletes must be 16 years old with parent consent if they're, almost adults, almost 18-year-olds. So I did want to mention that. Another question we have is there physical therapy services at Mercy Elite only for athletes, or other individuals would need to go to the Livonia Medical Center for therapy instead? That was another question that was just posed.
Well, the focus on physical therapy for athletes is at Mercy Elite, and we kind of use the 80-20 rule. Okay, so 80% of the physical therapy there is devoted towards athletes and their special needs. Maybe 20% is kind of an overlap with our physical therapy partner, Probility, which does a lot of orthopedic related physical therapy. We really have three streams of physical therapy work within the health system. We have the Probility physical therapy, which is often related to general orthopedic recovery, for patients who've had hip and knee replacements, and shoulder surgeries and whatnot. The athletic specialization of Mercy Elite, and then more advanced physical therapy for patients who've suffered strokes and whatnot are provided through our physical therapy resources at our hospitals. So those are the three streams.
Thank you. Okay, so this is really a question for Dave and Deb. Since the pandemic, has there been an increase or decrease in the number of students entering health professions? I mean, even before the pandemic, we knew there's going to be gaps in certain career gaps, and not having enough students to fill those. So can you speak to what you've seen post-pandemic?
Yeah, sure. Although community colleges across the country have witnessed a general decline in enrollment during the pandemic, enrollment in the health professions here at Schoolcraft has remained fairly consistent. So even though overall you might see a drop in enrollment, the people going into these health professions has remained solid. I think there are people out there that really want to be on the front lines and out there helping people. So people still keep signing up for those programs, and Deb can speak more specifically to the nursing.
Right. And in 2020, even during COVID, we actually graduated our largest class. The faculty did a great job, like on a dime, on 72 hours or less. They flipped all the classes that they needed to do. And then we were able to get them back to actual in-person clinicals, in May that year. So we were able to continue to graduate them. And then the faculty just keep alternating whatever we need to do if we're open or not, or on campus or not, or, and they're taking care of business. And we've been able to continue with all of our programs to get all of the students out on time and with a quality education. So they're still ready to go.
Great, thank you. Well, and on the flip side, with Dave Spivey and Dr. Ajluni, can you guys talk about what you're seeing in the healthcare in terms of what needs they're going to be? And is it the same post-pandemic? From an employer standpoint, I know we're educating, but what are you seeing gaps in?
I'll let Dr. Ajluni start, and maybe I'll fill in after him.
Yeah, I'm happy to. So all I can say to Debbie and Dave is keep the graduates coming, because we are in dire need of support. Our demand has increased. Patient care needs continue to increase, but we have struggled to meet that need from a staffing perspective. My particular purview of that is medical assistants, trained medical assistants. We have really struggled to, we have a number of open positions currently, and we're working hard to fill those. And that's actually impacted our ability to open locations, because we simply don't have medical assistants to support those roles. I know there's also nursing needs. Maybe Dave has more insight into that at the hospital. But absolutely, think it's probably multifactorial, and I won't get into all that, but there's definitely a shortage, and it's not perhaps unique to healthcare, but we are absolutely in need of support staff in that regard.
Ditto for the hospital. I think, that's obviously one of the critical needs. We're doing reasonably well, but again, looking down the road and there's going to be a need for a replacement of folks who are, moving into the retirement age. Coming out of the pandemic and during the pandemic, there's been issues of deferred care. So people who didn't seek care, that is increasing the demand on healthcare services. And as you probably read about, there's also been an increase in mental health challenges and substance abuse challenges. Those are rising issues in our medical practices and in our emergency rooms. And so those are very challenging, something that we need to think about. But I also, think that if you were to kind of describe, our relationship with Schoolcraft, it would be one of a holistic relationship. Obviously, what we do, job one is the provision of medical care services. And your job one is the education of students. But through our partnership, we've created, a very holistic and health-oriented capability that focuses not only on education or medical services, mental health, and physical conditioning. So kudos to really the leadership of Glenn and other leaders associated with Schoolcraft for inviting us in and helping create that holistic experience.
Well, and I think that wraps all the questions that we've received. If anybody has any last minute questions, I'm going to ask, for closing comments, remarks, thoughts. So I'm going, Dave, do you have anything else to add? That was a great way to add, but,
I do have another thing to add. I'm also great. This is a little less serious a topic than we've been talking about, but it's important nonetheless. Gratified that we're going to be a number of our food offerings at the St. Joe's. Joe's Java is going to be provided by Schoolcraft College. I'm looking forward. We've always had a relationship with your culinary program. I'm looking forward to taking this to the next level. And Glenn, we got to make sure we have the smoothies machine in there also.
Well, you know what? And I'll turn it over to Glenn. Do you have any closing comments, thoughts?
No, that's pretty popular on campus. So you can come. Yeah. We're gonna make you walk, Dave, over to the sports center. That's good for your diabetes, so you don't have to have diabetes.
Yeah.
So now I just want to say, I think, is it September 12th, Dave, that the 5K is that the date for Healthy Livonia for the 5K on campus? Is it?
We'll have to get that literature out. I think it's a Sunday. So if
we're doing
in September.
Yeah, we're just for those on the call, we're doing a partnership. Dave invited me onto the Healthy Livonia board, which is a combination of people from St. Joe's and from the Livonia Public Schools and the city of Livonia, and various other people. And we're partnering with them on the 5K that'll be held on our campus. And so because we can control our roads and we have a police force and we have a great place and now you can run around campus and we've got a lot of things to see. So if you haven't been to campus, come to the 5K and sign up for that. So we're going to encourage you to do that. We really want people on our campus. And that's the other thing is if you've been vaccinated, you're welcome on our campus without a mask, which is fantastic. We do require people that haven't been vaccinated to still wear their mask. But we're definitely welcoming. And we saw almost 75 kids yesterday, brand new kids. Stu Baker will love this, sitting and advising, waiting to be advised, not on the phone, but face to face. That's encouraging because that means they're coming back. So Matt, we're going to get you the people you need to hire. We're working on that every day. So, and Debbie and Dave Kesler and the whole crew over here are doing that. So I just want to thank everybody. I want to thank Don for continuing to do these educational pieces for the community, because that's what Schoolcraft's about, is partnering and collaborating with great partners like St. Joe's and Trinity and IHA. And we really appreciate what Dave and Matt and the whole crew, and we love working with professionals because we know it's going to better the community. So thank you for participating in this event today.
Thank you. Well, and just so everybody knows, in the chat box, we've put the link to the race, and it is Sunday, September 12th. So if you're interested, you can copy the link from the chat box. Dr. Ajluni, do you have any closing remarks?
I did just want to add one thing, and thank you to everyone. Thank you, Dawn and Dave and Glenn and everybody for this event and the partnership in general. One of the questions that had been sent to me was, how can the community, students and members of the community, utilize the new facility? And I just wanted to highlight the ease with which we can be accessed. You know, there's online scheduling for all of our practices. There's walk-ins that are taken at the urgent care every day. There's 24-hour call center support for all these practices. But, you know, you open up a new facility and you have all these specialty practices, and then you call and they say, how about 3 months from now, or how about 6 months? And that's absolutely not the case here. We at IHA and St. Joe's pride ourselves on access. And so our primary care offices are proud to say they have same-day appointments in most cases, and within 1 week for new patients. And our specialty practices are seeing patients within less than a week, which is really remarkable access for many of those specialties like vascular surgery and orthopedics and things like that. And so it should be very easy for students in the community to access and utilize these services as they need them. So proud to discuss that topic.
Thank you so much. You know, I really think that it's such an interesting conversation today about, you know, how education and the community all work together. You know, this type of a partnership, it's very unique and exciting from an education standpoint. Dave and Debbie, do you have any closing remarks? Dave?
No, I'd just like to thank everyone and say I look forward to continuing to develop this relationship and to continue to provide opportunities for our students in the community. Thank you.
And Deb?
And I would like to say I actually had to use the urgent care clinic a couple weeks ago, and it was great to be able to go over there. They got me in right away, took care of what the problem was, and that was awesome. So thank you. And then I'd like you also to get it back to the Trinity HR sites. I think they're doing a really great job. They seem to have elevated their hiring tactics and strategies. And we had one of our nursing assistants go to one of their fairs, and she got a job right that day. So, you know, and then we know we have nurses that are working at both St. Mary's and St. Joe's, but I think they've really upped their game a little bit. So if you could give them that compliment, then that would be great. So thank you.
One last burning question. Does the center provide COVID testing? What type? PCR? How long does it take to get results?
So there's testing available through the urgent care and in our primary care office as well, and in our pediatric office. And all those places offer the rapid testing, which is 15 minutes. That's the antigen testing. And then they're all offering PCR testing, which right now is taking about 24 hours. And we're soon to be offering, this is hot off the presses, but saliva testing as well. For those of you who don't like the Q-tip all the way in the back, you can just do a saliva test. So that's being offered as we speak. And you can schedule online for those appointments too, to get a COVID test at ihacares.com. You just click on save my spot, and you can easily book a COVID test that way.
At this point, we're almost out of time, but we're going to rerun the video. So those who wish to see that. And there's a comment, it's remarkable to know, Dr. Matthew, about the early access to the primary care services. Thanks for the information. And I'd really like to thank all of you for joining us today. Dave Spivey, Dr. Ajluni, David Kesler, Debbie Vendittelli, and Dr. Cerny. Thank you all for taking the time and having this conversation. We had over 50 people join us live, and we had over 80 that signed up to get this information, which will be sent through the recording. Again, thank you, and have a wonderful, wonderful day.